Imagine you go in for a liver scan. The result comes back in under 1 millisecond, not from a radiologist, from an AI running on light, not electricity, light. That just happened. And while most people completely missed this story this week, it tells you something important. Healthcare AI is no longer a future concept. It is arriving right now. And the people who understand it first will use it to make smarter health decisions, starting today. Let me explain what actually happened. Researchers at Shenzhen University just published a breakthrough. They built an AI diagnostic platform using something called photonic computing. Instead of using electrons to process data, it uses light particles. The result is extraordinary. It diagnosed retinal detachment and liver cancer at expert-level accuracy, and it processed a full liver CT scan in 0.8 milliseconds. For comparison, a standard GPU takes 85 milliseconds for the same task. That is 246 times faster. Think about what that actually means. A single doctor can only review so many scans in a day. A photonic AI system has no such limit. It could process an entire hospital's imaging backlog before lunch, without fatigue, without distraction, without missing a detail. And here's the part that makes this genuinely interesting. The system uses 246 times less energy than conventional processors. That means it could operate in rural clinics, in remote communities, in developing countries that currently have no specialist access at all. This is not a lab curiosity. This is a pathway to healthcare that reaches everyone. Hold that thought for a second, because at the same time this photonic story dropped, something else happened this week, something more immediately useful to you personally. Labcorp just launched an app called My Labcorp, and it is specifically designed to do one thing most people desperately need: help you understand your own lab results in plain language. If you have ever gotten a blood test back and stared at a column of numbers with no idea what they mean, you already know why this matters. Ferritin levels, hemoglobin A1C, thyroid stimulating hormone. These words mean nothing to most people without medical training, and most doctors spend about 11 minutes with a patient per visit. There is simply no time to explain everything, so most people go home confused, or they go home worried about a number that's actually completely normal, or they go home not worried about something they absolutely should be watching. The My Labcorp app changes that dynamic. It uses AI to translate your results into language a real person can actually understand. It explains what each marker means. It tells you whether a value is within a normal range. It helps you prepare better questions before your next appointment. This is not replacing your doctor. This is giving you the ability to walk into that appointment as an informed person, not a passive one. And that difference matters more than most people realize. Studies consistently show that informed patients get better outcomes, not because the medicine changes, but because they ask the right questions. They follow up. They catch things. They do not dismiss concerns. If you want more tools and insights like this, consider subscribing for future videos. New practical AI content every week. Now here's what gets interesting when you put both of these stories together. The photonic AI and the Labcorp app are not isolated events. They are part of a wave. AI is moving through healthcare from both directions simultaneously. From the top down, hospitals are getting faster and more accurate diagnostic tools. From the bottom up, patients are getting smarter about their own data. And the people who understand both sides of that wave right now are in a genuinely different position. So what can you do with this today? Let me be specific. Step 1, if you have had any blood work done in the last 12 months, download the My Labcorp app, even if you think you understood your results. Run them through the AI and see what it surfaces that you may have overlooked. Step 2, use ChatGPT as a companion layer. Take your actual lab results with your values and ask ChatGPT to explain each marker in plain conversational language. Ask it what questions you should be bringing to your doctor based on those numbers, not for a diagnosis, for clarity, for better questions. There's a significant difference between asking AI to diagnose you and asking AI to help you understand what you are looking at. The second one is genuinely powerful. Step 3, start tracking patterns over time. 1 blood test tells you a snapshot. 3 tests over 2 years tell you a trend. AI tools can help you compare results over time and spot patterns your doctor may not have flagged simply because appointments are short. This is basic preventive health care, but most people never do it because it felt complicated before AI. Now it takes 10 minutes. And honestly, this changes the relationship between ordinary people and their own health data. Think about how many serious conditions get caught late, not because the signs were not there, but because no one connected the dots early enough. A slightly elevated glucose reading 2 years ago, then again a year ago, and then a diagnosis. In each individual appointment, nothing triggered alarm. but as a pattern, it was screaming something. AI tools can see that pattern. Your doctor across 3 different appointments may not have the full context. You, with your own data and an AI assistant helping you read it, can. Now here's the bigger picture. Healthcare AI in 2026 is not about robots replacing surgeons. That narrative is tired and inaccurate. What is actually happening is more interesting. AI is making medical information accessible to people who previously had no access to interpretation. That photonic system in Shenzhen, its entire design principle was built around resource-constrained environments, remote hospitals, clinics without specialist staff, communities that wait months for a radiologist to review an image. For those communities, this is not a gadget. It is potentially the difference between catching a cancer early or catching it too late. And the Labcorp app, that is the same principle applied to your living room. Information that previously required a medical appointment to understand, now available to anyone with a smartphone. This detail often gets overlooked. The biggest shift in healthcare AI is not happening in operating rooms. It is happening in the space between appointments, the hours and days when patients are on their own, when they have questions but no one to ask, when they notice something feels different but do not know if it matters. AI is filling that space quietly, consistently. And for people who learn to use it intelligently, the results will compound over years. Better informed decisions, earlier conversations with doctors, less time spent confused about numbers, more time spent actually acting on what those numbers mean. The photonic AI from Shenzhen University will take years to reach widespread clinical deployment. The Labcorp app is available right now. ChatGPT is available right now. The tools exist today. The opportunity is not to wait for the technology to improve. It is to start using what is already here. The people who understand their own health data clearly make different decisions, consistently better ones. And AI has just made that level of understanding available to everyone. Not just people who went to medical school, not just people who can afford a specialist, everyone. That is worth paying attention to.